Hello, everybody. Welcome. Welcome. So excited to have you all here. Thank you for joining us today. We are going to wait just a couple of minutes, just a minute here. We've got almost 100 participants already. So we'll just wait another minute or so for folks to join. In the meantime, while we're waiting, I'd love for you all to introduce yourselves in the chat, drop your name in, where you're from, what hospital you're at. If you're joining us at your lunch hour, maybe tell us what you're eating. We love to eat meals together here at the Bridge program. So let us know what you're having for lunch, and we'll be getting started in just a minute. Hi, Troy. Welcome. Hi, Danielle. Excited to see you here. Thank you. Wow, awesome. Eminent Health. Hello. Turkey chili for lunch. That sounds delicious. Thank you. Now I'm going to get hungry. All right, we're about 111 participants. So as we get started, just a couple of logistical things quickly. This session is being recorded, just so you know, and we'll be sharing the recording afterwards. So it'll be available on our website, what we call the Navigator, Bridge Navigator program landing page. And it'll also be shared in email afterwards. So in case you miss any of the recording, you want to capture it. Ooh, someone's having lentil veggie soup. That sounds great. Someone's still having their breakfast. All right. Well, we've got lots of exciting content to you today. We're really excited to talk with you about an overview, give you an overview of the Bridge Navigator program, the funding opportunity. Let's see, another quick thing, closed captions will be available for anyone who wants to use that. So feel free to turn on that feature. And for any questions that you have that come up, we'll be doing a Q&A session at the end. So please hold your questions. You can also drop them in the chat. You can please use the Q&A feature. Actually, that'll give us a chance to answer your questions through the Q&A. So Q&A feature, or hang on till we'll be saving lots of time for questions at the end. So wow, we are 128 participants at this point. Let's go ahead and get started. Can we advance to the next slide here? So I'll just walk you through the agenda. I forgot to introduce myself, of course. My name is Rosalie Dutta. I'm Chief of Staff for the California Bridge Program. After we run through the agenda, you'll be hearing first from Arianna Campbell, Director and Co-Principal Investigator of our program. She'll be giving an overview of the California Bridge model, and then we'll shift into focusing more on the Bridge Navigator program. So you'll hear from Serena Clayton, our Executive Director, who will give you some background on the Bridge Navigator program, the goals of the program, and the deliverables and milestones. And then we'll be shifting over to the actual application process to apply for the funding opportunity. So Elizabeth Woodford, our finance manager, will be walking you through all of the resources that we have available on our website landing page. And then we'll go through a step-by-step of the application process. And finally, then you'll hear from Francesca Chiquin, our program administrator. She's going to walk us through the contract process very briefly, which is coming up ahead, just to give you a sense of what's coming. And then we'll move to questions. I'll be back with you to answer your questions and get all those questions answered either live or through the chat. So with that, I will turn it over to Arianna.
All right, I'm extremely excited to be here today, and they gave me like the best part to talk about. So I get to tell you all about the California Bridge program. So for those, some of you may know, but some of you may be a refresher, but we set out with this really lofty goal of 24/7 access to high quality treatment of substance use disorders in all California hospitals by 2025. And we're making a lot of a huge dent in this. You can see that we have this map that we like to show that shows access all over California. And this is so that we can provide real-time access, because there's so many barriers to treatment. So we had this vision that we developed a few years ago, and you're all on this call because that vision is being realized. So in this next slide, I'll show you where we're at today. So again, our goal is universal access to addiction treatment. Knowing how many barriers exist right now in California, we know that just by taking infrastructure, our emergency departments and hospitals, and applying the same type of structure to that we use for other medical problems, so there's a shared understanding that we can treat addiction, that we can save lives in our emergency departments just by doing the right thing at the right time, right? And we've made these huge strides. So in 2018, we started with just 8 hospitals. So just 8 hospitals. And in the last 4 years, you can see where we are now. So you can see that we have, we've made it more than halfway there, but we really are not going to rest until we actually have universal access to treatment. So on this next slide, I'm going to show you how we plan on doing that. So what we've been doing and what we found to be very, very effective is to use the model that's worked for now 200 hospitals, really adding on to what a lot of the hospitals already had. So part of that is having a clinical champion. So having a clinical champion in the emergency department who can provide, be a central person, who's the point person, who can really drive better care, can respond to medication-related questions, because we are advocating for giving buprenorphine for withdrawal in the emergency department. And they provide this sort of centralization, the staff person, that's the point person. And then we pair them with the substance use navigator. So what we're also calling a bridge navigator. So the bridge navigator is, we call it the secret sauce. So this is the person, this is what we're funding, right? This is a person that is able to advocate for patients, able to iron out all of the challenges just to getting medication. The goal, the dream is that we are able to provide this care and that patients will never know how many barriers there were before, because this has all been ironed out by the clinical champion, by the substance use navigator. And so the patient in the end gets evidence-based care without all of these barriers or without complications or challenges. And how is this working? Well, on this next slide, I'll show you. So really, this is the most up-to-date information we have from April 2019 to February 2022. This is huge. This is unlike anything else we've seen in the country. Our navigators have seen more than 112,000 patients through these emergency departments that we've already implemented in. So more than 90,000 patients were identified with opioid use disorder. So that question, I don't think folks in my county or in my hospital have opioid use disorder. We just have not found that to be true. The folks are there and need care. And we've been able to provide more than 40,000 patients the right medication at the right time that has proved to be life-saving. So giving this medication doubles their likelihood of being in treatment in a month and also reduces a risk of dying from any cause by 50%. And more than 40,000 patients have been given this treatment through emergency departments. So like I said, I get to be the cheerleader and tell you how amazing this is and how much impact we've been able to have. I'm going to turn it over to Serena to talk a little bit more about the specifics.
Great. Thank you, Arianna. I could listen to Arianna talk about this all day long. I'm Serena Clayton. I'm the executive director here at California Bridge. And before we get into the mechanics of the application process, I'm going to give an overview of this new Bridge Navigator program. So as Arianna discussed, we've been on this journey here at California Bridge to make treatment of opioid addiction the standard of care in emergency departments in California. And we've had several phases of funding. So in 2018, California received federal funding from SAMHSA as a part of what was called the State Opioid Response Grant. And at the state level, that money was administered by the Department of Healthcare Services, and a portion of it was awarded to the Public Health Institute and the California Bridge program. And we used these funds to fund 52 hospitals to launch emergency department MAT programs, medication for addiction treatment. So then the second phase of funding came directly from State General Fund, and this was called the Behavioral Health Pilot Project. And under the BHPP, DHCS funded hospitals directly. So even though we at California Bridge were providing technical support and we collected data, we were not actually administering the funds. Your check came from the state. And the BHPP funded about 200 sites at $100,000 each. So now we are fortunate enough to have a third round of funding. And I do want to take a moment to acknowledge the California Hospital Association, because we would not have this opportunity if it were not for their advocacy. So we now have the CalBridge Behavioral Health Navigator program. It's kind of a mouthful, so we are using Bridge Navigator program for short. And in this round of funding, the origin of the funds is the Federal American Rescue Plan Act. So it's what we think of more colloquially as COVID relief. And in this case, DHCS has again contracted with PHI and California Bridge to administer the funds in a similar way to what we did for SOR1. So for those of you who have been with us through this journey, here is the outline of the different phases that we've been through. So for this next round, the eligibility will be for all California acute care hospitals that have emergency services, either a standby, basic, or comprehensive. And it will be based on the list that we have linked here in the slides, but also linked in the RFA. So if you're not sure if whether or not you're eligible, you can check that list. We anticipate funding 300 hospitals at $120,000 per hospital. And applications will be considered in rounds. So if you miss a deadline, your application will be considered in the next round. The deadline for the first round is May 31st, and the last round is currently planned for January 15th. There is a possibility that the funds will be expended prior to that last round, so we do encourage you not to wait until the very end. The contracts will be for 12 months. So, expectations. What if you get this funding, what does it entail? So if you look in the RFA, you'll find the exact deliverables for each of the 3 phases of payments that will be part of the contract. But I'm going to provide a more high-level conceptual overview of what the goals and expectations for this program are. So the first set of expectations are around the Navigator. So as Arianna said, the Navigator is the secret sauce. And you are expected to have a Navigator at least 50% FTE. This can be a new hire, or it can be the continuation of a position that was funded through one of the previous rounds of funding. We've found that most hospitals have been able to hire a full-time position, and that is definitely the most effective, but 50% is like the minimum required FTE. So what does the Navigator do? The Navigator engages patients with SUD to initiate treatment. They link them with outpatient SUD treatment providers to continue treatment after they leave the emergency department. They address mental health conditions among patients with substance use disorder by referring them to community mental health resources. This piece is a bit newer, and I want to emphasize that it will be up to the hospital to define the scope of the Navigator's role in addressing mental health conditions. But we're supporting this kind of cross-training to address DHCS's goal of promoting integrated care, so that you don't end up with one set of folks who only deal with mental health and say, substance use isn't my job, and another set of folks that just address substance use and say mental health is not my job. We're trying to move towards greater integration to address the needs of patients more holistically. And then finally, the Navigator will be expected to participate in at least 3 trainings with California Bridge. These can be virtual, in-person, site visits. Now, in reality, we hope to see our Navigators way more than 3 times, but 3 is the required minimum for the contract. So the second set of expectations are for the clinical champion. The clinical champion should be an ex-waivered provider who is leading the effort to provide medication-assisted treatment with buprenorphine in the emergency department. And then the champion is expected to meet with the Navigator monthly. We've found that one of the keys to the success of this program is a very close relationship between the champion and the Navigator. So we are hoping that they will be meeting much more than monthly, but again, that's a minimum expectation. The champion will engage key stakeholders in the emergency department and hospital in a work group to develop and disseminate treatment and referral pathways for patients with SUD and behavioral health issues. Now, if that sounds daunting, don't worry, we have all of the resources that you will need to do that. The champion will also share nursing education materials and California Bridge training opportunities, because you really need the buy-in and participation from the entire ED staff to have the maximally effective program. And then lastly, the champion is required to participate in at least 2 trainings with California Bridge. Again, virtual, in-person, individual meetings. There'll be lots of options. We hope to see our champions many more times than 2, but 2 is the required minimum in terms of the contract. And then lastly, buprenorphine must be available in the emergency department without specialty consultation on a 24/7 basis for the treatment of opioid withdrawal and maintenance treatment of opioid use disorder. Okay, data reporting. There will be data reporting each month, and we will have a portal on our website. There will be 6 metrics that will be the number of ED or hospital encounters where a patient was seen by a navigator for any reason, diagnosed with opioid use disorder, diagnosed with overdose and seen by a navigator, treated with buprenorphine, discharged with an outpatient follow-up appointment with a substance use treatment provider within a week, and referred to outpatient mental health provider. So you'll be reporting monthly totals and then also breakdowns by patient, race, ethnicity, and gender. And we will be providing guidance on data reporting, such as ICD-10 codes, to help sites pull this information from their EHR. And then lastly, I just really want to emphasize that California Bridge will have a very robust support program for all of this work. Okay, we're going to have in-person trainings, COVID permitting, for clinical champions, nurses, and navigators. We are going to have regular webinars. There will be individualized coaching by clinicians with experience starting programs in their own emergency departments and who have experience coaching other hospitals to start their own programs. There will be support for navigators through regional work groups. There'll be coaching by navigator mentors, and we have a very active Slack channel through which navigators support each other. We will also be providing guidance on how to sustain this work, because these are really just startup funds, and we do not want this to result in a one-time program that disappears when the funding ends, but instead we want to see it lead to a sustained change in the services that are available at your hospital. And then lastly, you'll have access to our extensive resource library, which includes recorded video trainings, podcasts, treatment protocols, toolkits, and many more resources. If you haven't looked at this yet, I very much encourage you to go look at this tool section of our website. What I really want to convey to you is that if you receive this funding, you will not be out there on your own. Okay, we are 100% dedicated to your success, and that is the mission of California Bridge. So with that, I am going to turn it over to Elizabeth, who will walk through how to actually get an application submitted.
Hi, I'm Elizabeth Woodford, and I'm excited to talk to you about the application. So next slide. The first stop for everybody who is thinking about applying is our Bridge Navigator program landing page. So as you'll see, we have an overview of the program. And then if you scroll down, we have a long list of frequently asked questions that we're going to be adding to all the time, including after this webinar. So you can always check back if you have new questions that come up. We might have already answered them in the FAQ. On the right side, you'll see we have links to the application portal, the request for applications, full text, and then some applications attachments. And I'm going to strongly recommend that before you start your application, you review the request for applications and then at least the first 3 attachments, so that you have the application guidance. There's a preview of every question that's going to be in the application. And then for any of our hospitals or hospital systems that don't already have SAM registration, we have a wide variety of guidance on SAM registration. So once you've done all that and you're ready to sign up, go to the next slide and we'll see this is what the sign up page looks like. So I do want to highlight, I'm going to be going through this process as if I were a multi-hospital application. So there's 2 kinds of applications. There's for an individual hospital. You are an individual hospital, you're applying for your hospital. And then we have situations where we are going to have a hospital foundation or a hospital system that are applying on behalf of one or more hospitals. It could be a staffing agency. So the process that I'm going to walk through, all the questions are the same, but the format is slightly different if you're an individual hospital. So we're going to pretend like we're a multi-hospital pathway. So like I said, hospital foundations, health systems, staffing groups, or other entities can apply on behalf of one or more of the eligible hospitals. And if you're applying as a health system or a hospital foundation, please apply for all the hospitals in your system at the same time. That's just going to be expedient. We don't want to have multiple contracts over the different rounds of funding for the hospitals in the same system. And a hospital may only receive funding under one contract in this program. So you can't receive funding through a contract with the staffing agency as well as your health system. So only one hospital. Okay, next slide. All right, so if you were a hospital system, can you go back one? Actually, let's look at, I want to look at hospital. So if you're an individual hospital, this is what you can do on your sign up page. You would select which of the following best describes the applicant entity, hospital, and then you'll see a drop down of all eligible hospitals that you can start typing in the name of your hospital, and it will filter the list. So it's 300 plus hospitals. It's a long list, but you can filter it down by starting to type. And then it'll ask for your name, your role in the application, your email, etc. And then you can create an account. Next slide. This is what it looks like if you're a hospital system or foundation. Same thing. Which of the following best describes the applicant entity? You would say health system or hospital foundation, and then you could pick which health system or hospital foundation you are representing. And the next slide. If you are a staffing agency, you select staffing agency. We have a couple options here. We also have the option in all of these places for hospitals, health systems, and staffing agencies to add a new one. If you don't see your name on the list for whatever reason, please add your name of your hospital or institution. All right, so next slide. All right, so you've logged in, you signed up, we're doing a multi-hospital application. The first thing you see is our introduction page. It's some brief text with a link back to our Bridge Navigator landing page, and the email address. If you have any questions, please reach out to our Navigator program at cabridge.org email address. We have staff monitoring that email all the time. We'll get back to you as soon as we can. So please do reach out with questions. Next slide. Next, we're going to be asking about who is applying, who is the applicant entity. So getting some information about the hospital or the hospital system. Next slide. All right, next we'll be asking for the applicant entity representatives. Who can California Bridge contact if we have questions about your application? Who is the authorized signatory who's going to be signing this application and who's going to be signing a contract when it comes through? The same person can fulfill multiple roles. So someone could be the primary contact and the authorized signatory, or the contracting representative and the accounts receivable representative. So you can have the same name in here, but each contact is required. The finance department contact is going to receive, once you submit your application, the finance department contact that you put in here is going to be sent an automated email that's going to be asking them to provide the W-9, and if direct deposit information is required or requested, to send it directly to Public Health Institute. It's important that you reach out to this person to give them a heads up that this email is coming. We've had challenges with emails that come from the Navigator program getting caught up in spam filters. So please reach out to that finance department person to make sure that they're submitting the W-9 directly to PHI. We need a W-9 in order to process their contract. So please make sure this is happening. So next slide. Okay, so next is a compliance section. We need to know if we can contract federal dollars to your entity. So asking for a couple pieces of information here. One thing I do want to highlight is we are asking for your UEI number and your SAM expiration date. In some cases, you will not have a finalized SAM registration by the time you want to submit your application. Sometimes it takes a while to get your SAM registration done and approved by SAM.gov. So if you don't have that by the time you're submitting your application, you can provide proof that you have registered in the next section, the attachment section, and then we can move forward. But you do need to have SAM registration in order to finalize this contract. Next tab. Okay, so here we have attachments. So if your entity is using a NICRA, you'll need to attach it here. And then, like I said, if you have that SAM registration application that you need to provide because yours isn't finalized yet, you can enter it here as well. So all of this that we've done so far is the same if we are individual hospital or multi-hospital. The next tab is where it splits a little bit. So if you're a multi-hospital application, you're going to be adding information for each hospital in that application. If you were an individual hospital, you would just continue on in the application without this add hospital piece. But since we're pretending we're a multi-hospital application, we would go ahead and select add hospital. And then when you do that, next slide, it'll bring up a page where you get to fill out all the information about this particular hospital. So you can go ahead and search for the hospital name. You can start typing the hospital name to filter the list of the 300 plus hospitals. You'll be entering a budget for each hospital. We are asking for some budget justification. It's only 250 characters. It's not a novel, just a little bit about how did you get to this amount of money, and just some brief calculations and information so we understand how the budget's being used. As you keep scrolling down, you'll see the next slide. Each hospital in a multi-hospital application needs to have a letter of agreement. This basically says the hospital understands that this other entity or the hospital system or hospital foundation is applying for the Bridge Navigator program on their behalf. We don't want any confusion about who's applying and who's getting the money. So please make sure that every hospital in this application provides that letter of agreement. And the letter of agreement template is on the Bridge landing page. So that is available along, I think it's attachment 4 in your on the landing page. So please check that out. Next slide. Next, we're going to be asking about your MAP program key contacts. So who's supporting that implementation in the ED? Once again, the same person can fulfill multiple contact types, but all contacts are required except for the navigator if that person isn't hired yet. So the same person can be a MAT clinical champion and a navigator supervisor, but you need to have someone for each role. So you'll be able to click on add contact. And when you do, the next slide will pop up and you'll be able to fill out the information for this person and then toggle the roles. So if there are multiple roles, you just toggle the buttons and you'll be able to select this person having more than one role. Next slide. Okay, the last piece on the hospital for each hospital is areas of support. We want to get a sense of where is this hospital in terms of implementation of MAT. So this is not going to reflect or not going to affect the evaluation of your application. So you could say no for everything, and that's totally fine. We just want to get a sense of how can we support hospitals? We need to get a sense of where's the baseline. So once you do all of that information, the budget, the letter of agreement, the MAT key contacts and areas of support for each hospital in the application, you can go to the next slide, which is the review page. And this is only a snippet, but you'll be able to scroll all the way down and see that you can review everything that you have put into the application. And if you need to make any edits, you'll see a little pencil button that you can click on and go back and make edits. And you can scroll down. And then next slide. Once you're all satisfied with how this looks, if you're the authorized signatory that's filling this out, all you need to do is click, I am the authorized signatory, sign and submit, and then you're done. Next slide. If you're not the authorized signatory, in a lot of cases, the people filling out the application is not the authorized signatory, you need to click, I am not the authorized signatory, and then confirm who is. You'll have entered that person in the entity representatives page earlier in the application. An automated email is going to be sent over to the authorized signatory. And once again, please give that authorized signatory a heads up. Let them know this email is coming. We don't want it getting caught in a spam folder. So the authorized signatory can then go into the application, review it, and then say, I am the authorized signatory, sign and submit. Next page, next slide. Okay, once you've submitted, what's the evaluation process? So the evaluation criteria are the application must be submitted by or on behalf of a hospital or hospitals in California, eligible hospitals, and priority will be given to hospitals that did not previously receive funding through the BHPP. Our evaluation process begins once an application is signed by the authorized signatory, submitted and confirmed as complete. If you're eligible for funding and your application is complete, we plan to provide notification of selection within 6 weeks of that complete application. Next slide. Okay, I'm going to pass it off to Francesca to talk about the contract process.
Great, thanks, Elizabeth. Hi, my name is Francesca. I am a program administrator on the operations team for CalBridge, and I'm going to just give a quick overview of our contract process. So after we have selected your entity as a part of the Bridge Navigator program, you will receive a draft contract from PHI. This will likely come from Alex Soto or Andrea Chamberlain from PHI. And we recommend that once you sign your contract, that you send back your signed contract to that contact person who sent that original email so they can get it to the right person at PHI to then countersign. PHI will then countersign and send back the fully executed agreement back to you and your entity representative. So this is going to go out to your primary contact representative, and your authorized signatory. So you will all be a part of that contracting process. If you have any contracting related questions, we ask that you reply to that contact person who sends out the contract. They will help answer any questions you have and bring in CalBridge when appropriate. If you have any program related questions during this process, you can always reach out to the Navigator program email, which is navigatorprogram@calbridge.org. Once you have a fully executed agreement, CalBridge will be communicating with you and sending out a deliverables reporting form where you will fill that out to be able to invoice and get paid to meet your deliverables. So you'll get that form scheduled before your scheduled date in your contract. So be on the lookout for that. And then we also recommend that you look at the Bridge Navigator program landing page in the next couple weeks, because we'll be posting our registration link for our subcontracting webinar, which will be in June. So we recommend signing up for that webinar because we'll go more in depth on the information that will be in your contract. So that's just a quick overview of the contracting process. Again, we will go over more in our subcontracting webinar. I'm going to pass this back to Rosalie to start our Q&A.
Thank you, everyone. Thank you to my co-panelists for all of that information. Now we're ready to take your questions. So please note that, I will first mention that our FAQs are posted on the Bridge Navigator landing page, which is in the chat, or has been posted in the chat, and which we will share again. So we're updating our frequently asked questions a couple times a week. So please check back if you have questions from today's session that are applicable widely will also be posted on the FAQ. So look out for those. In the meantime, please ask your questions here. You can use the people have been using the chat, which is fine too, or you can use the Q&A to ask your question. You can also raise your hand and we will unmute you so you can ask us your question live, which is always fun to hear from all of you. So please jump in. Let's see what what do we have? So the first question, there were some questions also in the chat about the about SAM registration. So just to give a quick repeat overview of that, SAM registration means being registered in the System for Award Management, which is a federal government system that will check eligibility for receiving federal funds. So we have detailed guidance on how to register for SAM, which requires something called a UEI. It's a unique entity identifier. It's a number that is given to every legal entity that applies for such a number. So it can be really confusing. Have patience with the process. This is why we've detailed out some guidance on it. If someone can drop the link to our SAM guidance in the chat, that would help. But what the question here, if there's more than one SAM card, to just clarify that every application should have only one SAM registration. So even if you have multiple hospitals applying under that application, they should there should only be one lead applicant on the application that you're submitting for funding, and that applicant will have one SAM registration. So if you have follow-up questions on that, please feel free to drop them in the chat. We'll try to clarify, or you can email us. So that's on SAM registration. What else? What other questions do we have, Francesca? The follow-up on SAM registration. Yes, I would say that SAM registration is the very first step. That is a great idea. But you can also go ahead and register for SAM and complete your application at the same time. As Elizabeth was calling out, if you have started the registration process, it does take a little bit of time depending on how backlogged the federal government is, but you can show us or submit to us with your application like a screenshot or an image of a proof of registration that you've started the process, and that will at least help us begin processing your application. What other questions do we have?
Rosalie, it looks like we have a few questions asking about who is eligible for this funding.
Yes, great question. So if you are a acute care hospital in California with emergency services at any level, comprehensive, basic, or standby, you are eligible. We have a link to the list of eligible hospitals here, if someone can drop that in the chat. Are there more specific questions about eligibility?
I think that covers it. I'll look if there's
if you could definitely, right, sorry, excuse me, go ahead.
No, you're good. I'm going to move on to another more specific question that I think Arianna might be able to answer, which is, what is the best way to proceed if the emergency department would like to get this program going, but the hospital administration is lukewarm on having the role and definitely not interested in paying anything for it? Still apply through the hospital, apply through a staffing agency, or what is your recommendation?
Certainly a staffing agency is an option, and I know some hospitals have done that. But what I have found actually is really helpful is education. Doing a presentation to the executive suite, because we have a lot of information that we can provide that can help this conversation. And this is a very important conversation to have. And I think most hospitals don't necessarily know that until you're able to show them that this can decrease, for example, readmissions, that this can be, provide a more efficient and effective way of treating people in your community. And you can, also communicate to the community what you're doing to save lives in terms of the hospital. So there's a lot of great talking points. So sometimes it just takes a little bit of, I guess, accessing the executive, team at your hospital to get this message across. But I would start with education. And then there's a lot of other things that California Bridge can help you with there. And there's other options as well if that doesn't go well. So we have great support and can address it on an individual level as well. Thanks for asking it.
Thanks, Arianna. I've got a question in the Q&A here. Can you go from Kristalina? Can you go more in depth regarding Navigator pay? So I'd like to flag that we do have a resource available on our website. This is called the Navigator Hiring Guide, and it does include pay ranges for the position. We also encourage you to research the salary of other patient navigators at your hospital and within the region, because these really can vary from region to region. And then as well, we can also provide technical assistance once you're onboarded as a program and have received your funding. We can provide assistance on setting the salary for your position. The next question I'm seeing in the Q&A is about about reporting for. I'm sorry, I just lost this question. There was a question about whether if there's two sons in an emergency department, if the reporting is applicable to only one son. So Elizabeth, is that a question that you can answer? Elizabeth Keating, can you give us some? jump in for this one?
Yes, I can. Hi, everyone. Elizabeth Keating, CalBridge Clinical Program Director. No, we want all of the information for what your navigators are doing in the ED. So if you do decide to use this funding for one navigator and use another source of funding, or an existing hospital staff person to play the role of a second navigator, we definitely want data from both of those roles. We want to have the most robust data set possible about how many patients are being touched by this program. I'll also add that if you do have two navigators working at your hospital, they are both eligible to participate in our navigator training resources, regardless of the funding source.
Thanks, Elizabeth. Francesca, what other questions do we have coming up?
It looks like it was also answered in the chat, but someone asked if they can partially complete an application and go back to it. You do not, and I'll just answer that real quickly. You do not have to complete the application in one sitting. That's why you have a login information and create a password. So feel free to take your time to collect the information that you need, and you can go back and finish it when you're ready.
Perfect. What else do we have?
In the Q&A section, we got a question for Marcia. If the intention is between 0.5 and 1 FTE, then the navigator portion of this program is only available to ED patients during specific times that the navigator is working. So the rest of the time, is the process just the medication, but not the resource links?
Thank you. That would be a great
Okay,
question for Elizabeth. Can you jump in? Thanks.
Francesca, can you point me to where that question is in the chat? I want to read
It's
it.
in the Q&A section.
Great.
Yeah.
Oh, I see. Okay, the intention is between 0.5 and the navigator. So kind of. This is also something that Arianna might want to jump in and speak to. So the goal is that you will always be able to get the patient's contact information to the navigator. So say a patient presents at 3 in the morning when the navigator is not working because the navigator works something that looks more like traditional business hours. What will happen is that patient will either still be at the hospital when the navigator next comes on shift, or the patient will be discharged with that prescription for buprenorphine, and hopefully they'll have a phone number where the navigator can reach them. Often the patient's own cell phone, maybe that of a family friend or a caregiver. And then the navigator would, when they got on shift, they would see the patient record. There would be a flag for them to take a look at what happened to that patient, and they would give the patient a call and do a warm handoff to treatment in the community, or help them maybe get an appointment to get a longer prescription for buprenorphine if needed. So definitely the intention is not that navigators only see patients who happen to show up during the hours that they're working. Really good question. Arianna, is there anything you want to add about that?
Yeah, we built into our system, into our Epic system, just Sun Consult. And so that's really helpful, just so people know they can do Sun Consult at 2 in the morning, and it just gets populated into her workflow. So when she comes in, it's listed. But there's also really easy ways in different systems where you can just look if buprenorphine was administered. I mean, you can automate this. It's better to have a list. But if it takes you 6 months to make a change in Epic, there's things that you can do in the interim that are pretty simple to make sure that folks are followed up with. But yeah, and that's how we do it, because most of our places don't have 24/7 navigators, but we do have our navigators follow up to make sure that they've ironed everything out for people, pharmacy-wise and referral-wise.
Yeah, and I see a question coming in about having one navigator in the ED and another navigator in the inpatient medical floor. Ideally, we do want all of that data in one place. We do have hospitals that have very robust programs with MAT starts happening both in the emergency department and an inpatient department. Their numbers will often be higher than other hospitals. So we often will notice that that's happening because we do see higher levels of data. But, ideally, we really want to know everything that when you do go to report that data, we want to know everything that's happening in the MAT space. So any navigators working in any settings and all MAT starts that are beginning.
Yeah, and I was going to say, so often folks are started in the emergency department and just continued inpatient. So we all know that there's a lot of overlap there. So certainly we want to hear about all that. Thank you.
And
Thank you. Thank you. Francesca, do you have another question coming through?
In the Q&A, we have a question that says, is it okay to split the funding of navigators to cross-train them on infectious disease like linkage to care, HIV, STDs among people with substance use disorders?
Yes, thank you. Serena, is that when you, oh.
Serena can take that, or I can take that. Serena?
So I would say that is a practice that we strongly support. The technical requirements of this funding are that there be a navigator that is devoted 50% FTE at a minimum to working with patients with substance use disorders. So as long as that is in place, we are very supportive of additional training and services that navigators are providing to people with substance use disorder.
Thanks, Serena. And then just to sort of tack on to that question, there's another one that kind of follows on the same idea. Just to clarify, is the purpose of the navigator exclusively to address issues related to opioids or other substances, e.g. meth?
Again, I think that the answer to this is we are very supportive, and part of our mission is for hospitals to be treating all substance use disorders. So certainly we know that in some communities, meth and other substances are a very big part of the spectrum of substance use disorders. The focus of this program at a minimum is to have buprenorphine available for treatment of opioid use disorder. So I'd say that is a baseline requirement. And then beyond that, whatever other substance use disorders the navigator can build into their scope of work and that are appropriate for your community, that's something that you would have the flexibility to do.
Thank you. Elizabeth, is there something you want to add to that? Good.
No, just to say that I think that pretty much everybody on this webinar can probably attest that the reality is many patients are using substances in addition to opioids. So our training program does really equip folks to help pretty much any patient who comes into the door once you get this program off the ground. So.
Okay, and I was going to just on the person who asked about the infectious disease linkages, we're building this in my ED right now with rapid HIV and Hep C testing, and my navigator is driving this with follow-up. So just so folks know that it once you start doing this work, you find out how powerful it can be.
Wait, I have another question in the chat. What if we have one navigator in the ED and another one on the inpatient medical floor? Do we need to report that differently or combine all that data together?
Yeah, just to continue to reiterate the expectations for the data requirement is that we do ideally want all data for MAT starts and navigator touches coming from the hospital. So any setting that you do have access to the data about, we would like, and we do provide quite a bit of technical assistance about the best ways to create those data reports so that it's as painless as possible.
Thanks, Elizabeth. Francesca, other questions?
Yes, going back to reporting, will we keep reporting data for the current BHPP grant, or will this also be combined into a new monthly data reporting process?
Yeah, that's a great question. So the current BHPP funding data will be, you should continue to report through June. And in June, that will sort of officially mark the switch over. You can continue to submit. So we will be, that information will still be live. And depending on when your new contract comes on board, we will be switching over to the new data collection metrics. So the portal will be the same, and you should continue to submit your data through that same portal that you have available.
Rosalie, I think it's going to be estimated September that we will switch over to the new reporting requirements.
Right. So continue to use that same data portal up until you'll see the shift, which we're anticipating, I think August, September. Thank you. Other questions, Francesca?
I want to reiterate, this recording will be sent out for any folks who had to drop off and come back.
Thanks, Elizabeth. It looks like we have a few questions asking what the registration or incorporation number is.
Sorry, can you repeat that?
what the registration or incorporation number that we're
Okay,
asking on the
thank you.
application is.
Yes, for the application. Elizabeth Woodford, do you want to take that one?
Yeah, I just answered in the chat actually, or in the Q&A itself. But basically, every entity that's incorporated in a state has a registration and incorporation number. So this is something that your grants and contracts folks would have readily available, because this is just kind of a standard piece of information that you have about your company or organization. So please reach out to whoever the grants and contracts or maybe fundraising folks are in your hospital.
Thank you. I did notice a couple questions about technical problems with the application. So we can definitely help you troubleshoot those individually. The best thing to do would be to email us at navigatorprogram@cabridge.org. So, and we're gonna drop that answer right into that email address right into the Q&A as well. But it's navigatorprogram@cabridge.org. It's in the chat there. What else is coming up? What other questions do we have here?
Does the funding support only the son and 10% of the clinical champion salary, or can funds support a navigator supervisor or other members of the substance use treatment team?
Yes, great question. So the funding can support whomever and whatever costs it is necessary to support for your program to have the greatest success. So to directly answer that question, yes, it can support a navigator supervisor or other members of the substance use treatment team, as long as it has met at least the minimum requirement of supporting a navigator for at least 50% of the time, for 50% FTE.
Rosalie, just to clarify, when you said that the requirement, it's not a requirement that the funding support.
Thank you.
Yeah.
Thank you. Yes, I will add that you don't have to use the fund. If your navigator is already funded separately, you don't have to use the funds to support the navigator, as long as the program has a navigator for at least 50% FTE. So to clarify, you can use the funding to support whatever you need to support, you can put in any costs that you need to support this program, and whatever costs it will take you to meet the deliverables that are laid out in the program scope of work, as long as you do have at least a navigator on the program for 0.5 FTE. And if anyone has follow-up questions on that, please feel free to also raise your hand. We can unmute you and we can clarify. Other questions? What else do we see in the chat or in the Q&A? I'm seeing one come up about using funds to update the hospital website and for advertising to promote availability of MAT acceptable. Yes, it is. Advertising your program is really important. Doing program community outreach is also very important. If you're going to do that digitally through your website, as long as it is meant to support the objectives of the program, that would be acceptable. What other questions do we have? Got about 7 minutes here. Someone said they've internet issues. Will this be offered again? Yes, just to reiterate, I think that's been answered. We will not be offering this webinar again, but we will be posting the recording on the website. So you'll be able to follow along, catch up where you left off if you missed anything. There's a budget question here. The budget section on the portal does not allow for entries of other staff members other than the clinical champion. So if you have other staff members that you'd like to include, you can include those in other costs. There is a general line to capture any other costs that if you'd like to include. If you have any further questions, you should contact navigatorprogram@cabridge.org. We are collecting questions there and responding to emails frequently, and we are also pulling questions from our email and posting them on our FAQs. So do feel free to email us, especially because we've been sort of trying to capture all of these questions as they come in. If we've missed your question, feel free. We have about another 5 minutes left, so feel free to repost it. If we've skipped over your question for some reason, it wasn't intentional, feel free to ask it here, or also you can email us.
Rosalie, there was a question about the term FTE. So
thank you. Yes.
Confirm that stands for full-time equivalent. So yes, when we say 50% FTE, that means a half-time person.
Thank you. And sort of following up if there was a question about specific FTE and contracting issues. Same thing. We're collecting all our questions at the same email address, so please just email us there. Indirect costs. I see a question about indirect costs. Indirect costs are allowed if you have an indirect cost that is anything higher than the 10% de minimis rate, which is the federal code of federal regulations allow for at least 10%. If your indirect cost is higher than that, then you should have a negotiated indirect cost rate agreement to support what that higher rate of indirect costs is. So if you do charge more than 10% indirect costs, you'll need to also submit to us your indirect cost rate agreement as part of the application.
And let's also add that we are very much encouraging institutions to use the 10% de minimis rate if possible in order to maximize the amount of dollars that are going to patient care, because that is really the focus of this program.
Thank you, Serena. I'm also seeing a question come in about use of funding. Do all funds need to be used within the year? So the contract will be a fixed price contract, which means that you'll receive the fixed price amount to support your program, and we won't be requiring financial reporting. So at the end of the program, at the end of your contract term, you will receive your payment based on deliverables. If you achieve and meet your deliverables, then we will receive confirmation of those deliverables, approve them, and then issue your payment. We will not be asking for you to report on how those funds were used or when they were used. We do assume that they will be reused for the purpose of this program. That is within the scope of the project, but we will not require you to inform us whether you've used it up or not. It's not required to use up the funding within a year. Any other questions? We've got about 3 more minutes.
I still see 2 questions in the Q&A about what training is needed to become a navigator.
Okay, I'm not seeing, can you read the question out, Elizabeth? I'm not seeing those.
Yeah, it says, I am an SUDP working in a withdrawal management facility. What training is needed to become a navigator? Or is it only hospitals that can become navigators?
I can answer that.
Thanks, Carrie.
Let me go ahead. So we have a whole training program on our website. And if you want to reach out to me directly, we offer free training. So yes, anybody can become a substance use navigator and follow our model. So I would love to reach out, and I will put my email in the chat.
Thanks, Sherry. And we also have a resource available on our website about navigator hiring and experience and education. So if someone can drop that into the chat as well, that'd be great. Elizabeth, did you say there was another question?
Someone asked, have any other sites figured out how to capture the 3 new metrics related referrals? Maybe metrics related to referrals?
Yeah, Jody, we should talk about that one. That's a good question. And I think if you need support on that, others will as well. So let's talk about that. This is Elizabeth Keating. Can email me.
I do want to clarify, though, that the metric is not requesting, it's not asking for follow-up. It's not asking for the number of patients that completed the referral. So it's really looking at what's happening at the point of service in the emergency department. Were they referred? Were they discharged with an appointment?
Thanks, Serena. Perfect. Okay. And then I see a question here. Can you also explain the difference between a SUN and a behavioral navigator? So this is no difference. We've also answered it in chat here. These titles are just shifting a little bit. What was used to be called a substance use navigator, we're now using the term navigator or behavioral health navigator, but these are all the same position. Okay, well, we will be capturing all of the questions today that we received, and we will be answering those on our FAQ. If you have a question, we will be asking the questions that came up frequently. We'll be putting them in our FAQs, but if you have any questions that you haven't seen answered, please email us at navigatorprogram@cabridge.org. And oh, I got one more question coming in here. Oh, excuse me, that's a response from Melissa. So some sites are able to pull referrals from a discharge summary. Thanks, Melissa. As I was saying, we will be posting this recording on our website, and slides will also be available afterwards. We'll also be sending out the recording to anyone who's registered for the program. So thank you so much for all of your time. Thank you for joining us today. Looking forward to receiving your application soon. Thank you.